Hello and welcome to this month's Picture of Health. I'm your host, Lauren Lingell. On this episode, we're reviewing some of the show's best interviews. The first two episodes of Picture of Health tackled obesity with Dr. Joy Jackson, the director of the Florida Department of Health. From then on, we continued to delve deep into general health issues as well as crucial services in Polk County. Two of those services were the Polk Healthcare Plan and the Roar Home. We also learned about Alzheimer's disease, women's health issues, and the importance of mosquito control. Let's take a look.
Can you talk about any misconceptions about obesity that some people may have?
I think there's the inevitability of it, and if being overweight is something that's to be expected, and I think that's not the case, but it's something we all need to strive to not be overweight and obese. You know, it's difficult when you look around and you go into the grocery store or a restaurant or to the movie and you see so many people that are overweight. But it's not inevitable, and it is a condition that can, with time, be brought under control. And what we'd really like is for people not to become overweight or obese to begin with. So prevention and working with the youth and with families is absolutely critically important. Perspective from the public health standpoint is that obesity is an epidemic, and it is actually a crisis not only in Polk County, the United States, but also the world. But from an individual level, not to be overwhelmed, we each need to think of ourselves and to have discussions with your healthcare provider about what obesity or being overweight means for your health personally. We know folks that are overweight or obese have a higher incidence of chronic diseases such as diabetes, hypertension, high lipids, stroke, gout, arthritis, about 10 or 12 different types of cancers, depression. So there are many conditions that are associated with obesity. And in fact, some people view obesity as being a chronic disease in and of itself, but it clearly impacts so many other conditions.
Now, what is your take on putting children on a diet?
Well, we know statistically that about 1/3 of American children are overweight or obese, which is an astonishing statistic. Right. Over the past 20 years, our children are getting heavier. What we would prefer to see are children that are mentored and taught healthy living habits when they're younger to help prevent overweight and obesity from occurring. And it takes a village to teach children how to live healthily. It involves the families, the school, healthcare providers, and all of us. If a child does gain excessive weight, I think it's very important that these children and their families work with their healthcare providers for a safe way to lose weight.
How does the plan benefit Polk County residents?
Well, it provides access to means of getting services other than going to the emergency room, and for people who haven't gone to get care because they've had no method in doing so, they didn't have health coverage. What the Polk Healthcare Plan does is it opens up a number of access sites. We have over 200 providers in our network. We provide primary care, specialty care, hospital care, diagnostics, even medications. So this gives people the opportunity to get preventive care, and it also treats their conditions and keeps them from going to the emergency room for their primary care needs or waiting until they get to the point where it is emergent. So by getting the preventive care, it takes care of what they're going through in their episodes, and it keeps them out of the emergency room.
In terms of making our viewers understand it better, can you tell them about the differences between Medicaid and Medicare and the Polk Healthcare Plan and the Affordable Care Act?
Well, the Affordable Health Care Act was intended to cover all people in all states. However, one of the provisions in the Affordable Health Care Act was Medicaid expansion. And due to the case that went before the Supreme Court, it was no longer a mandate for all states to expand Medicaid, but a state option. Not all states expanded Medicaid. In fact, Florida was one of those. It did not. So in the Affordable Health Care Act, it included marketplaces or exchanges for people who made from 100% to 400% of poverty to get tax subsidies. So if they were between those poverty guidelines, they may be eligible for a tax subsidy to purchase private health insurance. However, also built in was Medicaid expansion, and because that was overturned by the Supreme Court, people who are under 100% of poverty aren't eligible for a tax subsidy in the marketplace. So, and because we don't have Medicaid expansion in Florida, there are many childless adults who don't qualify for Medicaid still. So the Polk Health Care Plan really serves those people that fall into that coverage gap, who don't have private insurance, they don't qualify for the tax subsidies in the marketplace, and they don't qualify for Medicaid.
To know, I can't wait to tell my mom. She's always telling me, oh my goodness, something's gonna happen to me. I'm like, Mom, you just gotta take good care of yourself.
Yes.
That's right. And that's the thing that you can do. Take good care of yourself, and if you think that there might be a problem, try to get evaluated early on. Because if you get evaluated and there isn't a problem, wonderful. But if you get evaluated and there is a problem, treatments are most effective in slowing down the progression of these illnesses the earlier they start. That's very, very important to start as early as you can. And so it's better, the testing for it, the evaluation isn't painful, it's not intrusive, nobody draws blood. Well, they do to take your B12 level, but it's something that people should do more of and not be afraid to get at least a baseline of how they're doing.
That's so true. Where can people get this evaluation? They just go to their primary care physician?
Well,
and ask,
Medicare
or?
actually pays for a memory screening in your primary care office. So I don't think people regularly ask for that, but you can ask, hey, can I have a memory screening? And the doctor should be able to provide that. So starting there, and then if the doctor sees that there's an issue, they can go further. Or if somebody goes to their primary care physician and they don't feel like they've gotten their answers to whatever issue it might be, short-term memory loss, cognitive problems, if they're not remembering names, then they can move on. They can go to a neurologist or a neuropsychologist, and they go to a specialist
So
themselves.
it's called a memory screening?
A memory screening.
And you would just ask one of your doctors that you'd like to have this test because you think that you're forgetful or you're experiencing some symptoms? That's great.
Now, can you talk about the different stages of pregnancy?
Well, the first trimester is really a time of development and growth, so all of the major structures in the baby are developing. It's a time which, for most women, is the most stressful because there's a risk that the pregnancy could be miscarried or lost, and because you can't feel baby moving at that point, and so you don't get that reassurance either. That's the greatest and most rapid period of development, is the first trimester, which is the first 3 months of pregnancy. Second trimester is more of a period of growth rather than development, so baby gains weight, gets larger, develops. And then third trimester is really a preparation for the outside world, so more weight gain and lung development, brain development, gastrointestinal system development.
So, Dr. Branch, what should women do during the different stages of pregnancy to keep themselves healthy? What do you recommend?
Across,
diet, exercise, whatever?
Certainly, I'm glad you mentioned that. We are finding more and more, both within pregnancy and outside, that diet and exercise are very important, particularly for those women who have issues with that prior to pregnancy. It's critical, particularly to prevent gestational diabetes, that they are on a good meal plan and have some regular form of exercise.
If people out there are kind of thinking and wrestling with that decision between keeping a loved one at home and having them there, what are the benefits of them being in a nursing home versus at home?
I would probably lean towards more of their safety.
Yeah.
Is what
It's
I would.
24-hour care.
Yeah, there's always going to be somebody we can't always prevent something from happening because there's not somebody on top of somebody 24 hours a day every second. But at home, if you have to, I'll be right back, Mom, I just need to go check the mail. You walk back inside and Mom's on the floor. It's just, anything could happen while you're sleeping. Mom could walk right out the door. You just never know. It depends on their mental capabilities, their physical attributes. Loved ones can end up hurting themselves trying to catch somebody falling or picking them up.
Administration of medications.
Yeah.
We have the doctor that visits so they don't have to leave. They come in. We address issues that arise if they have a change in their condition. We're able to address it and be preventative. We might say, okay, well, this symptom's happening, and address it with the doctor, and the doctor will write orders. So we try to keep them from going to the hospital, keeping them there at the rural home. So we do a lot of preventative things, and I think for a family, it's peace of mind to know that they have that 24-hour care, that we're, in continuity of care. A lot of us have been there for a long time.
Yeah, that's a big thing, longevity of the staff.
Yeah.
So.
Which says a lot about the facility, because I know that they have a high rate of turnover in typical nursing homes, because it's a hard environment to work in sometimes. But when the staff stays, that is saying a lot about you guys.
Right.
That you guys really are creating a family atmosphere and a place where the employees and the residents alike really enjoy being there.
So tell me a little bit about. Like with Mosquito Control, there's so many different things that probably have to happen. What is kind of like your typical duties as the manager there?
We oversee, the whole mosquito control program for Polk County, and our mission is to reduce disease-carrying and pest mosquitoes for the health and comfort of our citizens. Okay. Our program is based on science. We have an extensive trapping program where we set out small mosquito traps throughout the county. We have a network of 62 mosquito sites. We sample those weekly. We count and identify the numbers of mosquitoes. We graph those, put them into a GIS system, so we know where the heavy mosquito populations are throughout the county.
The biggest reason, one of the biggest reasons from what you've said, to control the mosquitoes is because of the health of the community. Why are mosquitoes so dangerous?
Our primary mission in mosquito control is to prevent the transmission of mosquito-borne diseases. There are a number of mosquito-borne diseases throughout the world that, in fact, they kill more. Mosquitoes are the most dangerous animal in the world. They kill more people than any other animal combined.
So people won't go swimming in waters where they know there's sharks, but they don't think about putting spray on before they go out.
10 people a year are killed by sharks worldwide. Mosquitoes kill roughly 750,000 people per year, primarily in sub-Saharan Africa from malaria. Some of the mosquito-borne diseases that have been in this area in the past or we are concerned with would be malaria. Everybody knows what that is. It's a parasite that's transmitted by mosquitoes.
I know historically yellow fever has been in Florida.
Yellow fever, West Nile virus came into the United States in 1999, and now it's pretty much throughout the United States. There's outbreaks every year in different parts of the country. We have a surveillance program for that where we put out chicken flocks. Some of these diseases are primarily bird diseases. And they cycle in the bird population, and then when the mosquito populations get very high, it will spill over and humans are dead-end hosts. Those would be like West Nile virus, St. Louis encephalitis, or Eastern equine encephalitis.
For our second segment, I got the chance to learn about the intricacies of United Way of Central Florida and Polk Vision, two of our vital community impact organizations. I also sat down with Joy Johnson, the Director of Indigent Health Care, to talk about why the voter-approved half-cent sales tax is crucial to our community. Lastly, I had discussions with our guests about HIV and AIDS, sex trafficking, and Winter Haven Hospital's Center for Behavioral Health. I would love for you to tell me a little bit about United Way in terms of, while it is a widespread organization and many people have heard of it, there are still some that aren't sure exactly how you would describe it. So tell us about it.
Well, thank you. United Way is sometimes thought of as an airline. We're not an airline. We are an impact organization. I think some people think of us as a fundraiser, and it's certainly important that we raise funds. The 2015 campaign raised more money than we have ever raised before at $9,081,000. A lot of money.
That's a lot of money.
It's a very generous community, and we're grateful for them. But we haven't met our goal. When that campaign goal is met, we don't meet our goal until we have made an impact in the lives of children who are working to enter school ready to succeed and graduate on time, until we've helped low-income families to find and maintain financial stability, and until we've improved the condition-specific health indicators of folks that are accessing or trying to access a medical home.
Though I am a resident of Polk County, I am sad to say that I don't know as much about Polk Vision as I probably should. So can you break that down for me and kind of tell me what the heck Polk Vision is and what do you all do?
Polk Vision is a collective impact organization. And by that, we believe that we can do better together than separately. Back in 2004, visionaries from across Polk County, business leaders and organizations came together, and a series of town hall meetings was held across the county. Several hundred individuals were polled, both in person and in writing, and from that, a visioning document was born. There are 6 pillars of interest. From that, that's the foundation for everything we do. It includes education, infrastructure, government, quality of life, which is where the healthcare initiatives come from. Civic engagement is also part of what we look into. So that means that we want citizens to be actively engaged and involved, and we challenge them not only to discuss, but to become part of the change.
So your mission isn't necessarily centered around health care or the health of an individual. It's really what makes a healthy community and working on those components to make sure that it's thriving and vital in Polk County.
Yes. So I would say the health of the community certainly speaks to the physical health, but I think we're talking about the cultural health, the mental health, the spiritual health of the community. So it makes sense for us to be here today, particularly with the health department being such a strong partner. But we are seeking a vibrant community where all participants have an equal voice and that we're engaged across all 4 corners of the community addressing issues that are pertinent to not just leadership, but to the individuals in each of the communities.
So why don't you tell us a little bit about what that voter-approved tax actually funds?
Well, it funds quite a bit, actually. It started with the focus being on the Polk Healthcare Plan. The Polk Healthcare Plan is set up to serve a manageable number of people every single month. And when I say that, I'm talking about an average of 5,000 Polk Healthcare Plan members every single month. Some come on the program and some go off of the program for different reasons. But that's what we budget, because the funds are paying for people for primary care services, specialty care services. The hospital services are the most costly, oftentimes that and diagnostics. But a plan member will also have access to medications, which sometimes can be expensive as well. So we budget to serve on average that many people every single month. And we know that that's not the answer to meet all of the needs of the community. So we have since broadened the scope and looked at other opportunities such as public-private partnerships in the community to see what else can we do to open up more access. And that includes other free clinics, for example, dental clinics, behavioral health services. So we have really looked at the scope to try to make sure geographically we do have services in the areas where people may not have transportation or have access to those resources within their community. And we've looked at a number of ways, including our mobile unit, to try to go out into the community to bring some of the information and program eligibility information to them where they are. So it's grown from just focusing on the Polk Healthcare Plan to a broader partnership with a lot of agencies in the community that are not-for-profit.
We've kind of talked about what HIV/AIDS is. How does one contract this? I mean, we kind of touched on it, but.
So as we talked about, you know, there's still some groups that are considered more at risk, and there's only 3 ways that you can contract HIV, and that is either through sex, through exposure to blood products, or through exposure through the uterus of your mother. So that's called vertical transmission or perinatal transmission. The most common way that people will acquire HIV today is through sexual transmission. When we talk about blood products, that is extremely uncommon in the US anymore, but there were people who could acquire HIV either through transfusions or say through certain blood products such as the factors that are used to treat hemophilia. You can also become exposed, for example, through a needle stick if you're a healthcare worker, but those are much less common and the risk is much smaller than it is through sex. And then there's obviously the risk if you're an IV drug user and you're using dirty needles.
So as you are beginning treatment with maybe a new patient, someone who is diagnosed with HIV, what types of medications are there that you put them on, or is it just dependent upon their situation?
So we're very lucky today. When I started, and as I said, I was not treating HIV in the 90s when people were really, really sick, and when they started out with AZT, where you had to take a break every 4 hours to take your medicine. But today, the medications that we use to treat HIV are somewhat easy to take. Now, let me start by saying we still don't have a cure for HIV. The medication is used to control the virus in the bloodstream, and in a minute I'll mention the advantages of controlling virus in the bloodstream. But we have at least 4 or 5 regimens that are 1 pill a day.
Wow.
So most people don't have to take a bunch of pills, and even those that are not just 1 pill a day are still very easy to take, very easy to take side effect wise. You know, again, if you go back to the early era of HIV, people would have so much diarrhea with the medications that they paired it to chemotherapy. Most of my patients now don't have side effects when they take their HIV medicine.
That's really incredible. I remember watching TV shows and the media always kind of paints things a little bit differently, but I always see 10 different pill bottles and things like that going on. So I guess it wasn't that far off, but just a pill a day. Huh?
That's the way it used to be. Nowadays, it's definitely not so difficult. But I don't take my iron half the time, so I can understand when my patients tell me even 1 pill a day sometimes is hard to do.
Right.
It's not easy to keep up with medicine even when it's 1 pill a day.
Are there places that you can identify where a victim is more vulnerable besides foster care, or, I'm talking about just leaving a store or something like that?
Any place where people gather, the mall, the movies, playgrounds. But the thing is these sporting events, football games, Super Bowl, Bike Week, all of those places where large group of people come in, large group of men come in, they're talking about supply and demand.
Right.
But they will actually bring in girls, women, boys, men, to be trafficked for these purposes. But it's really any place that people gather. And we've talked about these victims and who they are, boys, girls, men, women are being trafficked. Well, who are these traffickers? It's the same thing. It's boys, girls, men, and women. It's children, it's adults, it's grandparents. So it's hard to fathom that this really happens. But children are actually trafficking other children.
Oh my goodness.
I've read a story, and I've seen it happen in our home where they will traffic another child, for the purpose of making money off of that child. I think as parents or guardians, it's important that we know who their friends are. It's also important to know where they're going and who they're going with, and just some of those, you would think, basic parenting skills, but that doesn't always happen.
Right.
And social media is huge. Know the passwords, know what your children are looking at on the internet. Know who they are friending on Facebook. Go in there and look at their posts. Again, know their passwords. I think that is huge because so much, I would say over half of the children that get involved with this are actually something online has spurred that on, some conversation who somebody has friended them, and have no idea who's on the other end of that. I'm
Exactly.
I'm in I'm a 15-year-old girl, but I'm really a 60-year-old guy, you know?
Yeah.
So you never know. But it's knowing just really what your children are doing, knowing their friends, knowing what they're going out, what they're doing when they're going out. And as far as signs and things that you're, as a parent or guardian, may be looking at is, you know, is there a change in behavior? Has there been a change in music where maybe now it's more sexually suggestive? Is it the language? Because they are more sexually, verbally, you know, talking about it. There may be, you know, things that they're watching on TV. It might be, you know, just things like that.
That's got to be tough, especially in this like
we do live in an over-sexualized society. But just again, that change of behavior,
right.
really. Are they coming home with a $500 purse, you know, and you didn't buy it for them?
Right.
So where did they get that? You know, or they're getting their hair done or their nails done. You know, how are they paying for that? If you didn't do it, you know, who is?
So we talked a little bit about a couple programs you wanted to highlight and really spend a little bit more time kind of diving into. Why don't you share with us about those?
Our newest program is the Specialized Community Care Team, which is a partnership with the Polk County Indigent Health Care Program. It's SCCT for short, and that is a program for adults in Polk County, all of Polk County, who have a difficulty receiving services because of their own issues at that time and often transportation, but they're in desperate need for services. So we're able to go to those individuals in their homes, provide individual therapy to them and family members if needed, and to provide case management, link them up, help them identify transportation options, job options, housing options. And if they need medication, we can also arrange for psychiatric medication management services.
So how do these individuals find your program? How do they either get referred to it or access it themselves?
One thing we really like about the program is it's very available to everyone in Polk County that is in need of services. We currently are getting referrals from the health departments, some of the free medical care clinics in the area as well, the hospitals, the psychiatric inpatient units and the crisis stabilization units, and then just through word of mouth, people have identified it and they're calling in for self-referrals. Is this program a self-pay program? You accept insurance there, or is there some other type of funding? The funding is through our partnership with the Indigent Health Care Program through Polk County, and so there's no concern for the individual being turned away. Okay, and is there any eligibility criteria that we have to be? They do need to be a Polk County resident, and we're primarily looking for those who don't have other resources to pay for their services. Either they're uninsured or have a fund source that does not pay for behavioral health. Another program is our STAR program that also is available to anyone, and it is not, there are no criteria based on being able to pay for the services. If you come in, you're going to be eligible for some services. So we offer them as well individual or group therapy. They can have case management services to help them get those links that are needed so that they are able to maintain stability daily rather than just dealing with it in a crisis. And if they need medication management services, those are available as well. I hope you've enjoyed watching the best of Picture of Health. If you'd like to see the full versions of any of these interviews or previous episodes of the show, you can find them on the Polk Government YouTube page. As always, I'm your host, Lauren Lingell. Thank you for joining me on this month's Picture of Health.